Welcome back to Fiegel Files. I'm Beau Fiegel, the strongest lawyer in Texas still. No one's challenged me yet. I can't wait till that happens. Each week we're bringing the perfect mix of law, life, and LSU pride, and now health and wellness. Today on Fiegel Files, we're talking about what health really means, breaking down the myths of chiropractic care, and how taking care of your body and mind is the foundation for everything else, whether you're leading a team, raising a family, fighting for your future, or wanting to be an amateur strongman in a world final in 3 weeks. We're talking about me. My guest today is Dr. Justin Reyna, a manual and rehabilitation therapist, a full-time chiropractor, and newly minted master of functional nutrition at the Modern Movement and Spine Chiropractic in San Antonio. Dr. Reyna has a background in exercise and rehab sciences, athletic injury prevention, and has advanced manual techniques like active release, fascial distortion, that's a word, and Graston. I don't know what that means. So I'm excited. He's known for treating people and not just parts. She wrote this. I like that. We're keeping this in too. So he's known for treating people, not just parts, using movement, nutrition, and system-based thinking to address the root causes of pain and dysfunction. With 5 academic degrees, beating my meager 3, and a mindset of lifelong learning, Dr. Reyna bridges the gap between traditional medicine and functional wellness, helping patients build strength, mobility, and resilience from the inside and out. Hey, Justin.
What's up, Beau?
How you doing, buddy?
Man, 3 degrees is pretty meager.
It is. Honestly, I feel inferior right now, especially when 2 of them are for LSU.
Oh,
so
ooh.
I mean, what do they really mean, right?
Under a little heat after last weekend.
We'll get there. Did you watch any of it? No,
I did.
Oh man, that was fun.
Man, what do you think of? Oh, we'll get into it about the coach and stuff.
Oh, we can do it now. I don't care. I don't like content that like people just make up reasons to like hate on a coach. Like I don't need rage bait content in my life, but like you didn't fit the culture there. Like they didn't win. You can get fired. You don't get to complain when you make $10 million a year. Like you can take all the shit that people give you, but at the same time, you gave up 35 points in a row to a team that's never beat you in Tiger Stadium, and they don't have cheerleaders, and they're in a cult. Yep. You should probably be fired.
Totally. Isn't his season career at LSU like 34-14 anyways in a few years? So
I think 39-14. It's not like, I think 9, 10, and 9-win seasons. It's not pathetic, but
it's LSU.
It hurts that the last 3 head coaches all won national championships in their first 4 years.
Right.
And one was Ed Orgeron, who doesn't speak English. So, like, it's just, like,
yeah, that almost argues, like, you can do or not be skilled and probably do good at LSU as a coach, right?
Hopefully as a lawyer, too. Like, we have to, like, so
that's kind of still on, we haven't figured that out
We'll
yet.
figure that out. I'm only 13 years in, so who knows? That's fucking funny. Oh, man. No, it was unpleasant to watch. Yeah, I guess Tiger talks up front. It's fine. No, we'll be here all day. No, I like the interim coach, but he says the right things. It's scripted. Who knows, man? They all recruit well. They're all talented. Whatever.
It's LSU.
They'll be fine.
Mm-hmm.
They'll be fine. They probably beat Bama next week and piss everybody off.
Yeah,
and then all the rankings
right?
change and like whatever, mm-hmm. Dude. And we should hire that guy. I don't know, man. Again, Ed Orgeron, who's a funny dude, but again, barely speaks English and probably can't spell pass protection, won a national title with the best team in college football history.
That kind of fits Louisiana culture, right? Like not being able to really articulate.
I did it a gumbo, yeah. It's a weird place. Do you know who Huey Long was?
Mm-hmm. Yeah.
Tragically, no one reads history, reads literature, or watches documentaries. But like Huey Long, literally, people don't realize was actually close to being a candidate for president and might have won in the Depression. Wow. He was full on socialist, like a wealth cap, free school through college, and all this stuff that sounded great while he ran the most corrupt state in the Union. They had a rule that you couldn't invest money into the sports programs, and so to build Tiger Stadium, he put dorms in this actual stadium so they could build Tiger Stadium as built as it was. They had dorms through the early 90s in the stadium itself. Wow. So it's a rich tradition from my home state.
Bend the rules a little bit. Yeah.
They proudly, the legal is the Napoleonic Code versus the Universal Commerce Code. So their sales and shits is a little different for God knows what reason. They don't have counties, they have parishes. Sure.
Do things a little different.
Yeah, a little different,
well,
yeah.
They're little Texas, so.
I very little. This will tell you all you need to know. I graduated high school and, applied to like 8 different colleges. I think everybody applies to Harvard just to say you did. And applied to Georgia, I graduated Georgia. And applied to LSU kind of on a flyer. and I get accepted here, maybe a little scholarship here, denied here. LSU, full ride, bro. It's like, sure. That says it all.
We'll take it, yeah.
Look, I got you. They've got a 25% denial rate, so good for them.
Yeah.
I love my alma mater. Well, here, where'd you go to college?
Oh, man. Which degree?
Undergrad.
Undergrad, I graduated from Texas State.
Texas State is San Marcos, right?
San Marcos, yeah.
So you from here?
Oh, man. So I was born in San Antonio, and then my father was working for Halliburton in 95, and so we moved to Brazil.
Oh, shit.
Yeah.
That's really cool.
Yeah, so I grew up in Brazil, Venezuela, Argentina, Mexico, South Texas, graduated high school in Poland, and then moved back to San Antonio.
Do you speak other languages?
Just English.
What a waste.
I
How
know,
do you live
dude.
in like 5 Latin countries and not speak Portuguese? Or
Yeah, I was such a shy kid. Like,
really?
Crazy shy, dude. Like, we'd go to McDonald's and I'd hide behind my mom's leg and stuff. So I never put myself out there to learn another language. And that's such a huge regret.
That's crazy.
Mm-hmm.
Yeah, I hate to start in a downer, but for 5 degrees
Yeah,
and not one of
surprised
them.
he's not that great. Right?
Yeah. So you graduate, you said high school in Poland?
Yeah.
What brought you, well, so did Halliburton take you to Poland?
Yes.
And
Well, actually, my dad retired from Halliburton and then 2 months later started working for Chevron. And that's why I moved to Poland.
Okay, good deal.
And that was in 2012.
Yeah. You graduated high school in 2012?
14, baby.
Oh, my God. I graduated high school in 2003.
Whoa.
Wow. Yeah,
Whoa.
That's painful. Why San Antonio then? He's not even home. Why
Yeah.
Texas State? I guess San Marcos, Texas State.
Good question. So San Antonio, because I decided to move back to the States after graduating high school, and my brothers both lived in San Antonio. My parents are from Pleasanton, which is 45 minutes south of here.
Yeah.
It was close enough.
Okay.
Yeah.
Like close enough you can justify not going home on the weekends, but close enough you can when you're broke and need to do your laundry.
Correct, right? You're 18.
Yeah.
And then Texas State. So I started at UTSA. I don't know. There was just something about it. I didn't like it. Actually, it's
They
interesting.
have a stupid mascot.
Yeah, exactly. Right,
Yeah.
a Roadrunner.
Yeah.
It's interesting. I tell my patients this a lot, especially the young ones that are talking to me about what they want to go, study in college and stuff. And they say, "Oh, Dr. Reyna, you're so smart. You have 5 degrees. You're such an academic." Well, I didn't do very well at UTSA, right? And at that time in my life, I sort of didn't identify as an academic or somebody that, and so I was sort of like trying to figure out my identity, my place. And there was this cool program at Texas State called it was exercise science with an emphasis in physical therapy. It was a pre-physical therapy program. So I went there and I was like, oh, this is great. I think I want to be a physical therapist. Happy that I ended up going down a different route. So after I graduated, I started becoming a personal trainer at Gold's Gym, and I started working with my previous business partner at New York Wellness Center. At the time, I was bodybuilding and I tore my shoulder. I went through 16 sessions of physical therapy, which I was pretty interested because at the time I was considering that as a potential route. And my shoulder did not improve at all. And looking back at it, it's because I was doing really basic work, like rubbing a towel on a board, doing arm bike, like stuff that creates zero adaptability. And my coach at the time, John Jewett, who's now a IFBB Pro Mr. Olympia competitor,
Oh, okay.
he said, hey, there's this machine called a NewFit, the newbie.
Oh, okay. I
And-
hate that. Stupid
Yeah, I know you love that thing.
Yeah, we'll get there.
What's really cool is their headquarters is in Austin.
No shit.
Imagine that. So I drive up to Austin, try out the newbie, do 2 sessions on it, and my shoulder's back to normal.
Wow.
Yeah, right? So, like, after 8 weeks of PT, zero progress, you do 2 sessions with this direct current modality.
Something's different.
Something's different, right? So I purchased a machine, and I go through the coursework, and I was like, wow, I really agree with a lot of this, the paradigms, the neurophysiology here. This is cool, and this makes a lot of logical sense to me. Well, come to find out years later, that's all chiropractic principles. Because chiropractic is extremely heavy on neuroscience, physiology, and how the body actually works. And so instead of going against the body's grain, which in my opinion is a lot of what modern physical therapy does, I started going down, hey, how does the brain work? And is the brain the thing that actually controls our pain receptors, which we know it is, and the tension in our muscles? And so because of that, the newbie was really popular, and I started to lean more and more towards chiropractic. I don't know if you have a question about that, but...
We'll get there, but go ahead.
Cool. No, go ahead.
No, I was going to say, this can be organic. So we're good. Yeah.
Cool. So a couple years go by, we started Modern Movement back 8 years ago before I was a chiropractor. And
You started it before you were a chiropractor?
Yeah. Oh, yeah.
Okay.
Because I was just doing new fit rehab.
Okay.
Right? So it's really extrapolated and grown into something that, I never thought it would. We rented out space to 2 chiropractors in the building that I was in. And that was my first experience with chiropractors that had a specialty. So these are called chiropractic neurologists. So much like medical doctors, we can specialize in a branch of chiropractic. And I was so fascinated with the way that these 2 doctors, Dr. Aaron and Heath Root, they still practice here in San Antonio, and they're twins, identical twins.
That's crazy.
It's crazy, and they're awesome, wonderful
Kind of
people.
creepy, probably.
I was really fascinated with the way they practiced, and so much of how they approached patient care is how I always imagined doctors would and should be.
Yeah.
But doctors, for the most part, don't practice the way that I saw them practice on TV and old TV shows,
Well, sure.
And what I mean by that is I feel like a doctor is a huge pillar in the community. They get to know the families of their patients. They put their hands on their patients to evaluate them. They look in their eyes, look at their blood pressure, which they do now, but they look deeper and they care more about the whole human than I think a lot of what we see in modern medical practice. And this was the first time I really experienced it. I was like, wow, is this what a chiropractor is? I think I want to go into that. So then I applied to Parker, actually, pivot. I got another master's degree in rehab science. That was my first one at the time. Then I applied to Parker University and then started their doctorate of chiropractic program.
Okay.
While I was there, in the first 2 trimesters, I was like, oh, I can get another bachelor's degree here. And so I got a degree in anatomy and physiology.
Did you say trimester on purpose?
No, they're trimesters.
Okay.
Yeah. So chiropractic school is 10 trimesters. It's a 4-year program, and you get 2 weeks off between trimesters for 4 years. That's the longest break you get. And you can take up to 32 hours in a trimester.
Jesus.
Yeah. Chiropractic school is very intense. And we go over a ton of different things. We are definitely by a mile trained the most in spinal manipulation out of any profession, but I would say that's maybe only 10% of our education is spent on spinal manipulation.
All right, yeah, I want to pause there because I want to get to the differences in medicine versus chiropractic and that. But when you hear chiropractor, I think 90% of people think YouTube and as loud as the cracks can get, and that's it. I mean, you're laughing, but I think it almost gives you a bad name.
Oh, no, I agree.
Yeah,
I agree.
So flesh out more. What is a chiropractor? What does it mean? Distinguish from a quote-unquote medical doctor, which might even be a hijacked term a little bit. So give it a little more context there, because what actually is a chiropractor? I think that's a fair question, because when I think of it, I think most people think of it as like, I want my back pulled, a little bit of a rubbing, and this kind of like almost what do you call it, like an Eastern medicine technique and alternative and aromas and candles and then mystic, and like, no, actually it's medicine. So.
Yeah, that's a really good question. So to your point, I think there are 2 major camps of, let's just say Americans, right? It's chiropractor, I have a negative connotation, or chiropractor, I love chiropractors.
Right.
You kind of get both ends of the spectrum. So a chiropractor is a natural medicine doctor. Chiropractors are the largest natural health care profession in the world, okay? And what's really interesting is I think this concept of functional medicine has become really popular in the United States. What people don't realize, functional medicine is chiropractic training. And what I mean by that is what we study in chiropractic school is very similar to primary care physicians training. We get a lot of anatomy and physiology. Actually, we have more anatomy and physiology training than medical doctors do. We have more physiology training than medical doctors do, which is the study of how the body actually works.
It works together, right?
Correct.
Yeah.
We have less training in pharmacology than they do, but we still have training in pharmacology because we need to understand how drugs work. And there's actually several states where chiropractors prescribe medication.
I was going to ask that, yeah.
Yeah, so it varies by state to state, and it typically has to do with how much influence does the medical board have over the state practice laws.
Of course.
Right,
Yeah.
as you would expect.
Yeah. A lot of the case research, because I was looking for a case to kind of have fun with, most of the cases were lawsuits from the medical board suing the chiropractic board on what they were and weren't allowed to actually do as treatment.
That's huge. And I think that's a good talking point for why a lot of people have a negative connotation of chiropractors. Early on in the chiropractic profession, early 1900s, the medical board openly created a lobbying group that was entirely geared towards disenfranchising chiropractic, which is illegal. And in 1985, the American Medical Association actually lost a Supreme Court case against a chiropractic American Association for doing that exact thing.
We should have researched that, before the podcast. That would have been a great idea to talk about that.
Yeah, oh my God, right? Great legal piece, right?
Yeah.
But so that lobbying group didn't end until 85.
Wow,
right? Like what year were you born? 85, right? And you think about your parents and your parents' parents that were exposed to this information in the newspapers. It could have been on public news media of things that were designed to make chiropractic and chiropractors look like they're not legitimate.
Yeah.
And in that process, I think it's a blessing in a way because it has forced the chiropractic profession to almost legitimize itself. And what I mean by that
prove itself.
Exactly. Like our education is so incredibly evidence-based, and we are so on top of making sure that we're following gold standard in our education and in our treatment plans and our patient management because we don't want to create fuel to the fire or give people a reason to already think something.
So I believe all that because I know you. Like you treat me openly, like that's how I know you. But do some of the chiropractors do that to themselves when they get YouTube channels and how big the cracks can be?
Oh, totally. I mean, what's the saying? All publicity is good publicity for them specifically, right?
Sure.
Like they're growing and they're creating a revenue source off of YouTube. And some people like to get cracked like a glow stick, right? Like that's an appeal to some people.
I guess.
But yeah, I know. I don't understand it either. But the thing is
it's my least favorite part of the treatment.
Yeah. And honestly, I love spinal manipulation because it's so incredible and so much research is coming out about the benefits of it, but it is only part of the treatment. It is a tool in the toolbox.
Yeah.
Right? And what's cool about it is as I'm assessing and I'm placing my hand on the patient, I can feel the texture, the tone, and the movement of their body. And that can give me an indication of what's happening internally in the patient.
Yeah.
Now, to your point about chiropractic and systems biology, which is the understanding that nothing happens in an isolated way in the body. Nothing's isolated in the body.
Of course not, yeah.
Anything that's happening is happening to everything. And so we start putting together a clinical picture of, this Achilles tendon reflex is decreased. Somebody has a loss of the lateral 1/3 of their eyebrow. Somebody is developing myxedema under their eye, which is puffiness under their eye. This person has thinning of their hair, skin, and nails, and they're a little bit overweight. That could be a thyroid disorder. Even if it isn't showing as full-blown hypothyroid on their labs, they're presenting as if they have a thyroid that's sluggish or it's not performing. And I can gather all that information as I'm assessing the physical capacity of this patient, something that is not commonly done in medical practice anymore.
So, and again, this isn't, the point I was talking isn't to like trash common medical practice, but let's, and I know you're not, but like, why is that? And I have a feeling a lot of it is, and I don't even think nefarious, but how medicine's funded through insurance companies and lobby, and how they make their money. That'd be my guess. So
yeah, and to be clear to your point is, I think medical doctors are amazing. There's no other profession that I would rather see in a crisis.
Yeah,
without a doubt. But I do think that the healthcare term is a bit of a misnomer because the reality of allopathic care and pharmacology, the introduction of medication is it doesn't make you healthier in any way. It blocks a system in the body that is dysfunctional.
Yeah.
But
flesh that out and more. I understood it. I'm proud of myself with my 3 degrees. But break it down. What I understand it to be is it's almost reactive.
Oh yeah.
Medicine, quote unquote, modern medicine or modern medical and medical MD care is reactive. You have cancer. You broke your leg. You stick in your eye, major cut, or a major thyroid issue, or you need a those things that I don't understand you'd be trained to take care of. You need the precision that requires. You have a heart attack, you need a cath, a stent, or open heart surgery. All of that. What I understand from your end though, and what the part you provide, and maybe they don't, is the life management and the health overall, the wellness overall. A theme I've had when I had Austin on and when I had the therapist on was when we were talking about strongman and then just mental health in general. It was funny. What helps your mental health and what helps your wellness the most? And there's a lot of central themes: sleeping, drinking your water, eating protein intake, getting some sunlight. And it's funny how that all seems to match the management system. You're all of a sudden you're stronger, you're healthier, and your mind works a little bit better. And I think you provide guidance into how to actually be healthy and functional in general. Is that fair to say?
100% true. The things that have the largest lever on our health systems are almost always free or low cost.
That's funny, right?
Right?
Yeah.
Get sunlight in the morning.
Yeah.
Sleep 7 hours.
Yeah.
We
laugh because it's obvious because, and I think this would be overly simplified and critical, but if I came to a medical doctor, I'm struggling to sleep, I think there are some that might react and say, here's Ativan.
Oh,
if I went to you and it says I'm struggling to sleep, you'd be like, okay, well, your hip is displaced, or yeah, this system isn't working. Let's try walking before you go to bed. Mm-hmm. Or I don't want to oversimplify, but I think those approaches have a long-term effect on curing the sleep issue. Whereas the Ativan will put me to sleep. I'll rest that night to a degree, right? But I haven't fixed the actual underlying issue.
Yeah. So DC, which is the title after Doctor of Chiropractic, is anecdotally termed in the chiropractic profession Doctor of Cause.
Okay.
Right? Because it is our goal, and from the very beginning of chiropractic's genesis, if you will, is we have always been a cause-oriented healthcare profession. Now, the way that we go about that varies from chiropractor to chiropractor, and it varies from specialist in the chiropractic field to another specialist. But our goal is always to find out, why is this happening? And if we can figure that out, is this patient's overall health capable of functioning to its most optimal degree in such a way that prevents or limits their ability to generate a disease, right? Likelihood to develop a disease. Is, yes, it's very possible that you may be prescribed a sleep aid when you go see a medical doctor and you have unresolved sleep issues. But there are an infinite amount of things that can cause disturbed sleep.
And I want to pause, this isn't a criticism of doing that.
No.
That's not the problem. I think and again, I don't mean to interrupt the point, but just to keep it, the problem is if that's where the analysis stops. Yeah. Is that fair to say?
The buck should not end there.
Right.
Ever. So in my thought, and again, I'm not a medical doctor, I do not prescribe medication, but my thought would be, okay, if you're going to use a sleep aid, maybe that's what you initially introduce as you investigate, right?
Yeah.
So what I may do is I may, after evaluating the patient, I may introduce melatonin early on, and if they have trouble staying asleep, I may introduce 5-HTP, which is something that produces melatonin it's like slow release melatonin essentially.
Yeah.
It's a serotonin that we produce in our gut, which may also clue me in. Most of that serotonin is produced in our gut. Is there some type of GI issue that could be facilitating the sleep disturbance? Another thing that I may think about doing is recommending that my patient gets a continuous glucose monitor that they put on their arm, that they may have on for 30 days, which will create a graph of what their blood sugar looks like all day long, particularly at night. One of the biggest things that wakes people up at night is their glucose actually drops. They become hypoglycemic. So I may suggest that this person consumes some type of protein or slow digesting carb before they go to sleep. I mean, there's just so many different things.
Even if they're not diabetic?
Even if they're not diabetic. Oh, absolutely. I have a patient right now. She's 49. She's 125 pounds. Very fit. Yes, yeah. Fit. She works out a lot. She's not diabetic. Her hemoglobin A1C, which is a 90-day snapshot of your glucose, is 5.1. That's pristine, right? 6.5 and above is considered diabetes. I put a CGM on her, and the only reason I did that is because I ordered labs on her, and I noticed, wow, she's hypoglycemic on these labs. That's interesting. And it was in the afternoon. So I said, hey, I think we should use a continuous glucose monitor. She put that on last week. It's been 7 days. She's had 8 hypoglycemic events since wearing that CGM.
It's just is it the pace of her diet?
Well, it's a lot of different things.
Yeah.
So turns out she does consume alcohol frequently.
Probably doesn't help.
It doesn't help because that affects the way that your liver can metabolize, store, and regulate your glucose.
Okay.
Yeah. It also affects mitochondria, which is a really big talking point not only whenever we're in 7th grade science, but in modern cellular medicine.
Well, it's your energy source, right?
It's your energy source. It's the way that we process. It plays a big role in processing energy. Food is energy. Carbohydrates are the major energy source for most people.
So if you're drinking before you go to sleep, it inhibits that capacity to do that. Well, and all of a sudden, you don't have... Go ahead.
Not just that. It's not happening around when she's drinking. She's affected her liver so much from the regular alcohol consumption that she's no longer regularly stabilizing her glucose.
Oh, wow.
Yeah, exactly.
So is it chronic at this point?
It's chronic. So I believe it's something that's reversible, but she is what we call a reactive hypoglycemic. So whenever she consumes food, her body inappropriately regulates her glucose so much that it drops down.
Oh, wow. Because it's used... Okay.
And you wouldn't think that with somebody that's fit.
Right.
You know?
Yeah.
But if you don't look into it, you can prescribe this person medication, or you can go down a rabbit hole, and you're not looking at one of their most integral physiologic systems, which is their blood sugar regulation.
Well, what sets you... Because nothing you said, I don't believe a medical doctor can't do.
Oh, they absolutely can.
So, and again, I didn't mean to suggest you said that, but why is it more likely that you would do that than a medical doctor right now?
That's a good question. So, my education in the chiropractic field is through the American Board of Chiropractic Internists. So we specialize in internal diagnosis, management of disease within the body. And in that program and in that process, what we do is we enact a system that's called systems biology. And so what that is we look at how do all of these different organ systems interact cohesively. So if there is something going on in lab work or in my patient whenever I'm assessing them, I never think of it as just one problem. I think of how is the harmony within this patient's body. So I'll run a detailed panel, and I may notice that their blood sugar is off. I may notice that their cholesterol is off. And the way that I look at labs is with two hats. And this is one of the major differences, is in standard allopathic medicine, and this partially has to do with insurance, and my thought, right? Yeah. Which, to your point earlier, insurance companies, pharmaceutical companies, massive companies, they fund a lot of the education in medical school.
Of course they do.
Of course they do, right? And
not all that's bad. Sometimes they fund the research to solve things. Like this isn't like a shot at big business on its own, but that it has collateral consequences.
Of what it is.
Yeah.
It's the reality of capitalism. My practice is all out of pocket. So I'm able to order whatever lab I want, whenever I want it. And
you don't answer to anybody for that.
I don't answer to anybody for that.
Yeah.
Now, of course, it is very important that I screen those labs appropriately and I don't miss things. A big part of being a primary care physician level provider, which chiropractors are, is that we need to be extremely good at differential diagnosis. When something comes into our office, we need to know what's going on and who to send them to.
Yeah.
That's a huge part of chiropractic school is patient management. How do we, as a central hub provider, disperse and make sure that this patient is cared for in the appropriate way? So back to the labs, and the fact that I'm able to practice the way that I want to, and the benefit to the capitalist system is it behooves my patients to have a very good doctor, right? And, right in the private world, right? And so I make sure that I'm ordering enough labs to get the full picture of my patient's health. A big example, and we keep talking about blood sugar because it affects so many systems, is if somebody has low testosterone, right? And by the way, low testosterone is not below 300 like it says on the lab. Low testosterone in my world, in the optimal functioning world, is how do you feel, number one? Fair. Do you have symptoms of low testosterone? And objectively, we know that below certain numbers, you have increased risk for neurodegenerative disease, you have increased risk for cardiovascular disease, and you have increased risk for joint pain and musculoskeletal issues.
Is it low relative to lifestyle too? And what I mean is, like, if you get someone overweight and with a very sedentary lifestyle and their number's 500 versus you get someone 25 actively lifting weights and their number's 500, would you say that one's low, like because their lifestyle wouldn't support that it's low, or is that a dumb question?
No, that's a good question. So in my world, I'm going to look at that testosterone in the overweight individual and say, okay, your testosterone is likely inhibited by X, Y, and Z.
That's what I meant, yeah.
Now, if I have a young individual, an athlete, for example, that has the same level of testosterone, very different lifestyle, I will still explore as to why that's happening.
Sure.
Because, there are scenarios, what's called hypogonadism. You're not producing the testosterone, and that's the only problem. But very rare do I see that, right?
Is that like the classic, you wore too tight of underwear and it stopped? Like, don't wear whitey tighties?
Well, it could be that. It could be something you're born with,
Right,
It could be a lot of different things. But many signals from the brain go throughout our hormone system to initiate the production of hormones. Blood sugar regulation is very important. If we're inflamed in our cardiovascular system, we're very likely inflamed in our testicles.
There,
right? Consumption of microplastics. If we're drinking a lot of these plastic water bottles, or if these plastic water bottles are sitting out in the heat and now we're consuming them, right? That a lot of those things make their way into your testicles, and that can affect the way that you produce testosterone. It could be something as simple as having a zinc deficiency, which is very common in the United States, because zinc is the cofactor necessary for the last step of testosterone synthesis, and that's something I would certainly check for.
Yeah. Not
something that's commonly run on labs at a standard medical practice.
I 100% didn't know that. So
yeah, so a lot of these different things, right?
That was in the 4th degree, not the 3rd one.
Yeah, if you got one more, you would have got that, right? But, the idea is, okay, what are these really, really large things that can affect the whole body? And in the DABC program, which is the chiropractic internist program, we have a acronym that we use that is just like, this is basic before we even dive into anything. We call it bail them out. That's blood sugar, anemia, infection, liver, exercise, microbiome.
I'm going to pause because it's funny, because the acronym in medicine is what? ABC, airway, breathing, cardio, right?
Exactly.
So
exactly.
We've hit it on the nail. Like wellness living, again, that's not even a shot at medicine, or you're going to fucking die. Right? Is that fair?
100%. Okay. I'm trained in some emergency care, but please, if you have a nail in your head, do not come to my office. Go to the emergency room.
Yeah. If you're going to make a mess while I'm waiting for the EMTs, you should have called in the first place.
Dude. Yeah. And they're so good at that. Oh my God, skilled. But the problem is that that juxtaposition you just created is we're so good at this, just as good at this as they are at that.
Yeah.
And that needs to be acknowledged across the board. And it also needs to be, put in a position to where, hey, you're coming in for your primary care visit. I think that maybe you'll do better with a natural medicine doctor. Is that something you're interested in? That's not a conversation that happens at the MD's office. Yeah. Never, right?
Which is crazy, because I don't know too many doctors that are like begging for business.
Oh, no.
Usually they're in a practice, and this isn't a shot at them. They're in a place where usually it's hard to get an appointment, because they're in a practice that, insurance directs you there. You call 6 weeks later, you get your P&C visit.
That's another thing. They're not incentivized to be excellent and up to date. In fact, the doctors, number one, they have the most empathy. They care the most about their patients at the very beginning of medical school.
I believe that.
Right?
Yeah.
That's number one. Number two.
This is hitting my lawyer heart too.
Yeah, it happens, right?
Yeah. I want to save the world. No, just fucking pay me and shut up.
Right. They're in such a position because they essentially have unlimited patients coming in through most systems.
Yeah.
That they're not incentivized to be up to date and to be the sharpest, best doctor they can possibly be. It's almost left on the merit system. Does this doctor want to be the best doctor, or are they jaded?
Yeah. And it's easy to get jaded. I don't even judge it happening.
In any profession. Yeah. Any profession. It's human nature. You're overworked. You have life, spouse stress. You're a divorce attorney. You understand how that works more than anybody. Why would we assume that a doctor of any sort is immune to being a human?
No.
They're not.
No.
Right? So I think that there's really so many different factors into why we practice differently.
Yeah. So to get to the bullet points a little, because I think we've done well. The first was the gap between traditional medicine and wellness, and she writes treatment focused versus prevention focused. And then the next was explaining chiropractic medicine in detail more than just the cracks. So, which are fun videos. I mean, I talk shit. They are kind of fun.
They're
videos.
entertaining. It's like akin to Dr. Pimple Popper.
That's fair. Yeah, has a role, right?
Yeah.
The next thing she writes is the importance of empowering patients to understand their bodies.
Huge.
Yeah.
So, back to the point about chiropractic education being extremely evidence-based. Something that is almost to nauseam pushed in our education is a medical model that's called biopsychosocial. And that's the understanding that everybody that presents themselves in my office has a biological or a biomechanical reason why they're in my office. They have a psychologic implication to what's happening, and there's a sociologic piece to that as well, right? So, for example, you are a track superstar. You tear your hamstring. How does that affect you psychologically? Then how is that affecting them socially? For example, you're a track star. You hurt your hamstring. I'm no longer part of the track team. Ooh, what's my identity now? Yeah. Hey, my name is Justin. I'm the track star. Oh, you can't say that anymore. You're not the track star anymore.
Right.
Your social group is all track athletes.
I can't play with the group anymore.
Exactly, right? Mm-hmm. So what we try to do as best we can is, number one, make sure the patient is not overly identifying with their injury. It's huge. The number one predicator for chronic pain is people's belief system on pain. You know, there's a saying is if you're not practicing placebo, you're not practicing medicine. And what I mean by that is if your patient believes that they can get better, their likelihood to get better is so much higher than somebody that truly believes they can't. Oh, I herniated a disc 10 years ago. I have a disc herniation. My back's been bad just like my daddy's back was bad, right? Well, surprise, disc herniations heal. Surprise, back pain's not genetic, right? But this person's identified with their pain, and that is now who they are.
Now, I agree with that, and couple it with if the only care they're getting is a pain blocker, a shot.
Correct.
What do you call it? Are they steroid shots in the back or whatever, right? But nothing to treat. Like, actually, this disc is mildly herniated. You could strengthen here. Anyway, sorry.
Well,
but
yes,
so couple those two together, it's going to stay chronic, right?
Exactly. So, unfortunately, the reactive medical model has taught people to identify with their issue. It has also, the reason it doesn't work very well for pain and for wellness is because, let's talk about pain for a second, is many pain issues are a mechanical problem. How can you fix a mechanical issue with a chemical? Impossible.
You can mask it.
You can mask it, absolutely.
And let's make it worse. You can make an addictive issue that creates a lot more issues.
Oh my God,
right?
That's a rabbit hole we can dive into. But let's talk about something as simple as an NSAID, a non-steroidal anti-inflammatory drug like ibuprofen. It can be helpful sometimes. But if you use it in the acute phase of an injury within the first 72 hours, you can take away the body's natural inflammation response. You can reduce it starkly. Well, it turns out we need that inflammation response
to put blood into the actual,
and to move tissue out, and all this stuff. So you can take an acute injury and turn it into a chronic one. Yeah. So not only is it likely that you'll delay your recovery time by taking these drugs, it has ancillary effects. For example, every single time you take a single normal dose of ibuprofen, you get a 2 milliliter bleed in your stomach.
That's crazy.
Every single time, no matter who you are, and that's if you take one dose of it.
Yeah.
You're bleeding, right?
There was a time I lived on it because I was working out and I didn't see people like you.
Right.
And so every day I took 4 to 6 as part of my day.
I had a patient since college football. He was in his 40s. He's taken over 30 a day. Unbelievable. And guess what? You look at his body and he has arthritis everywhere. Increased risk for arthritis development with that drug as well.
Yeah.
Irony, right? And what you'll find is almost all medication is robbing from Peter to pay Paul.
Yeah.
Whatever you're taking the medication for and you get off of it, you are now less resilient at actually managing that physiologically. I'll give you an example. Trizepatide, Ozempic, Wegovy.
Well, I was going there. Go ahead. Yeah.
That's very popular. It's a GLP-1. We can stimulate GLP-1 naturally, right? We can improve our body's ability to stimulate that. But if you take the drug, one of the known side effects throughout this weight loss that you experience on the drug is you also lose muscle mass. Mm-hmm. Well, muscle mass is our big metabolic engine. That's where we store glucose throughout the day.
Yeah.
Well, you get off Ozempic, they say your glucose goes up after you get off of it. Well, yeah, you have less muscle now.
Yeah.
Oh.
But one of my favorite conversations I had with you, we have a mutual friend. I'll name him because he's a buddy, and I don't think he'd mind it. Gabe Molina, who had us both on his podcast. Guy. A very good guy. And I only am willing to bring him up because he's been candid about struggling to lose weight.
He's open.
Yeah, so that's the only reason I would, and he's been very gracious with some tips on podcasts and stuff. But, I believe what you told me is, he'd be a good candidate for it. So pause. We just criticize the shit out of the drug as a problem, but they all do have their place.
100%.
Right?
Every drug does.
Yeah, so it's not an insult to, don't ever take it, but don't crutch, right? That's not the answer.
Yeah, it's
the exclusive answer.
The philosophy of the application is the argument.
There, I like that. Mm-hmm. I would say the same for testosterone.
Really anything, right? Because testosterone and most hormones operate on a negative feedback loop, meaning I take exogenous hormone, my body stops producing endogenous hormone. Mm-hmm. So I get off the testosterone, I'm no longer producing as much testosterone. And don't get me wrong, there reaches a point in a time where, if you want to have optimized hormones, you will likely benefit from hormone replacement therapy. Yeah. I have good friends of mine, they're 65. They smoke regularly. That's the only negative health habit that I know that they engage in.
Smoke like nicotine
cigarettes?
Okay.
Yeah. They grew up in Brazil.
Yeah.
In the 60s. Yeah. Common, right? Inundated in the culture.
Common everywhere in the 60s.
Yeah, totally. In U.S. for sure. They used to prescribe it for anxiety in a medical doctor's office.
I mean, it's not...
It's good for your heart, they
inappropriate.
They used to say it was good for your heart.
Yeah.
So, anyways, I've checked their testosterone levels. They're in their 60s, and their testosterone's over 900.
No shit. Naturally.
Nice. Pretty incredible. Myself, actually, whenever I was 20, I was bodybuilding. I was training 6 or 7 days a week, eating a tremendous amount of carbohydrates, staying up late, eating a lot of fat, too. My testosterone was 303.
Wow.
That's 3 points away from medically diagnosable low testosterone.
That's crazy.
I went to my urologist, and they wouldn't do anything about it. They said, you're fine.
Because it's 303?
Yeah.
If it was 297, we'd prescribe?
Oh, yeah, exactly. Yeah.
So if you'd done it a day before or a day after?
There's normal fluctuation. Had I gone in a different day, I might have been lower. Yeah, all the things.
That's crazy.
Anyways, about the testosterone is, I don't even remember where we're going with that, honestly.
Well, you had started with NSAIDs, and essentially that medicines, I want to get your words right.
Yes. So most medications make you less resilient at the end of the day.
Right.
So what I would do in a mechanical scenario is this person has pain. They have an injury. I want them to process the inflammation faster. A really popular therapy that's been engaged in a lot of people's life and in the functional medicine space is red light therapy.
Yeah.
Red light therapy is not anti-inflammatory. It accelerates the rate at which the cytochrome C in the mitochondria can process inflammation.
Okay.
That's very, very different. Number two is it actually stimulates mitochondria to repair tissue faster.
So does that make cold plunges problematic because it stops the inflammation by reducing the blood flow, or is that a good thing?
You could make that argument. So there is some research that shows that cold plunging around exercise can attenuate hypertrophy.
Oh, wow.
Yes. So here's the thing. What is the purpose of the cold plunge? Because if you understand the purpose, you understand anything, you understand the target of what you're trying to do, the application changes. So would I use cold plunging for a pain therapy? Absolutely not. But I would use cold plunging as an activity to reset dopamine pain pleasure threshold.
Okay.
Right? So we have this really interesting neurotransmitter called dopamine. Dopamine, you could argue dopamine is the realm of a neurologist because it happens in the brain.
Right.
You could argue dopamine is the realm of a psychiatrist because dopamine manipulates behavior. It's a reward system. It's something that gets us to do what we want to do, gets us moving, right?
Right.
You could argue in the functional world that dopamine belongs to the gastroenterologist because we produce a lot of serotonin and neurotransmitters are manipulated in major part by our gastrointestinal system's bacteria and short chain fatty acids. So what I would do is I would look at this patient and I'd say, okay, I'm starting to analyze some behaviors in the affect of the patient. And is this patient kind of compulsive in what they're doing? They may have a dopamine threshold issue.
Yeah.
So I may suggest, hey, I think cold plunging might help you because it's a painful behavior. It's uncomfortable.
Yeah.
So whenever we engage in dopamine, it's very pleasurable. We like to do things that pleasure us, hence dopamine. So for example, I love food. I'm a big foodie. I get a lot of pleasure out of consuming food with people, particularly. And that gives me a lot of dopamine. If I continue to consume food, these hyper palatable foods by myself, that can become a problem.
You look like me.
Yeah. And so from a neurotransmitter perspective, engaging in something like cold plunging may be effective as an ancillary or an adjunct therapy in resetting your dopamine pain pressure threshold.
So now this is a rabbit hole, but I got to ask, because like most people, myself included, would describe once it's done a euphoria.
Yeah.
After. So I thought, am I increasing, or help me out there?
No. So whenever we engage in a dopaminergic activity, let's say food, my dopamine just pumps.
Right.
Shoots through the moon.
Well, you can make it worse. Jokes aside, cocaine, right?
Yeah, drug, pornography, there's a lot of these different behaviors, right? We have a normal resting dopamine threshold, okay? We engage in the activity, it spikes up. Then when it inevitably comes down, it actually becomes lower than our regular threshold, and we experience a period of maybe mild depression.
Our body can't keep up, right?
Yeah, and it needs to reset. You do that long enough, your resting dopamine threshold is lower and lower each time you do that.
Wow.
Yeah, that's why, for example, a drug addict or a sex addict or somebody that has a eating disorder in terms of too much food or any behavior really, it gets more aggressive because the things that gave them dopamine initially are no longer giving them enough because they're starting from lower and lower and lower.
Wow.
Yeah, it's really interesting. And you know what's interesting about it is that many addicts they eventually reach a period where they no longer even want to engage in that activity. They actively know, man, I need to stop doing this. I don't feel good. It's not making me good. And they keep doing it because they want that dopamine. That's a major driver for what we do in life. It's almost like a dog. You turn into a dog digging for a bone that doesn't exist. You're never going to get there. Social media is another way to go.
I mean, I remember with cocaine very distinctly.
Sure.
Yeah.
Anything, dude. It's like it can be any behavior that gives me a massive amount of pleasure. It can be anything.
So how does the reset in the tub?
So the opposite of pleasure is?
I assume pain.
Pain.
Yeah.
That's the only way that we can reset dopamine.
That's crazy.
But yeah, it is crazy.
I mean, and cool.
It's fascinating.
What
really
a non-5 degree way to react to that. But like that is incredibly interesting.
It is, and pain is entirely subjective. For example, how many people do you know that don't like to read?
Everyone.
Yeah.
Except like the people I have on the podcast.
That hurts my heart, dude, because I love to read.
Yeah.
Readers are leaders, man.
Yeah.
I would like to make a point when it comes to reading. When you experience new words, you can experience the world differently.
It's
and
true.
That's beautiful, dude. Like, if you hear new thoughts, you can see things different, and you can express yourself differently. That's why education is the greatest joy of my life, and why I continue to pursue it. Because it has set me free and allowed me to experience the beauty of interaction with people in the world in such a way that I want to share with everybody, which is the whole reason I'm on this podcast.
I couldn't agree more. The richness, the vocabulary, the chance to imagine something and experience. I don't know that I have a particularly big vocabulary compared to most people I would compare myself to, but I get accused of it. But the opportunity in language to be more precise, it's not an arrogant. I am not using it. Some people do. Some people are like, they found a new word. So like, we're going to say someone's recalcitrant rather than evil because it's easier to sound cool.
Right.
But it's so much more fun to be precise. And what I love it is we're both mutual friends with Austin.
Not only precise, but the fact that you, for your Rolodex, chose this word. It's got to mean something. It's got more meaning to it.
It does have more meaning. We're both buddies with Austin, and who's quietly way smarter than he wants to admit. Yeah. My wife is an example of this. She's high school educated, and she was on the podcast that hasn't come out yet, the therapist, and like amazingly insightful and self-aware. And it's funny. She's like, I'm not dumb. I'm dumb. I can't compare. Like, you're actually quite brilliant. Why? Because you took the time to read. You pause and listen. But to the vocabulary point, like that, there's a beauty in being able to read and articulate. And people who are wonderful with words, poets, and it's akin to someone like Mario who does art and like our tattoos, my tattoos, because you're not cool. But there's an expression that you just can't grasp. So I agree completely.
If you know how to read, and you choose not to, nothing separates you from somebody that's illiterate.
It's fair.
What a sad reality, right?
It is. Yeah.
You have this. You have everything at your fingertips, and you don't choose it. And there's people out there that haven't had the privilege
to learn how.
Yeah. That would probably kill for it.
Yeah, I don't do enough of it. I enjoy it the times I take to do. Obviously for a living, I get a chance to read case law and there. So there is like an exhaustion element. You know me, I work out a fair bit, so I'm pretty tired and my eyes glaze when you're tired.
We all have a bandwidth.
Yeah, but I'm with you. Like I watched the Lincoln Lawyer series on Netflix because it's cool.
Very good.
But the books are so much better. And again, that's not a shot. The actors are great. The depth is great. I don't have a criticism of the show, but you can't on film most of the time encapsulate. But here we'll rabbit hole a little more. I think there's a weird. How do I say this? There is nothing wrong in my mind with some self-indulgence, right?
Of course,
you can watch.
It's not only as a human, it's entirely appropriate.
Right? Yeah. So mine is I've got Dragon Ball the freaking tattoos. I would say to a degree sports.
I never knew that was a Dragon Ball Z tattoo.
That's hilarious.
I think you're a lot cooler now. You need you need a Frieza on there though.
So
I'm a villain guy.
I've kind of got villains because I've got Vegeta,
Super Saiyan 3 Goku. Is that Beerus?
No, this is Ultra Instinct.
But that's down at the bottom.
Beerus.
One up.
Piccolo.
Oh, it's Piccolo. The forehead almost looks like Super Saiyan 3 Goku.
And then I've got
Teen Gohan,
Majin Vegeta, but I took the M off.
That's a villain.
Yeah.
Maybe an anti-hero.
Yeah. Piccolo's a villain through the first series.
In Dragon Ball.
And Beerus is sort of a villain, almost a prop.
Yeah.
he's cool as hell.
He's a bar for strength in Dragon Ball Super.
Yeah, it's funny. I love how bad they are at writing because they write themselves into a corner. Like, so I use 80% of my power, and that doesn't make sense the rest of the freaking series.
It's so bad. It's so bad.
I love it, and all the same.
Yeah.
But no, so I've got guilty pleasures, but I also say even in like what you choose to consume media wise, you could watch Real Housewives or you could watch The Sopranos. There is a distinction. Now, is The Sopranos TV series ever going to compare to a book series? I can't make the argument, but at least I think there's a level you're indulging on something that's expanding your vocabulary, expanding your mind, and artistic expression. Better Call Saul is better than, I don't know, insert cable program here. So.
Very relevant to you. That's how I imagine you as a lawyer. No comment.
There's so many parts of that series that are great.
If I ever needed a lawyer, I would want for them to be like the way I would imagine my CPA to be, where they're
take advantage.
They're getting it done. There's a loophole. They're
the line's harder, I think, than people see. The last guest that published, Laura Hernandez, we had an extensive conversation about CPS, and she runs a place called Blue House, which does basically supervise visits and provides services for parents to reunite.
How awesome.
It is a beautiful mission. And I wasn't going to challenge this lovely human being, an older lady who's going to come on my podcast. I'm not going to go after her, sit in that chair. But she does represent parents in a lot of these, and I think kowtows a little bit because she cares so much about the kids. In my mind, my role isn't that. I'm a check on the system. I'm the asshole. Like I'm the guy, who fights the state tooth and nail for every piece of evidence. A little
bit more principled, perhaps.
different principles, different goals, because I do think she's principled in her care for kids. I'm hesitant to do that. In my worst days, I would agree with you.
Let me say what I mean by principled is not the flexibility of principles. I'm talking about objective principles of what a lawyer satisfies on paper. Is what I mean by that.
Yeah.
Not philosophy, which is a little bit more flexible.
Fair. Yeah. It's really interesting in my world because like there's such a murkiness. Like in family law,
Sure.
you know, if I take myself out of it and my desire to get paid, because I could litigate a simple case forever and just take someone's money. That's not good for them. So if I'm really self-interested in the client, if I'm interested in the client's welfare, help them do its best, but I also work for them and their goals. And so part of my job has to be, let's set appropriate goals that are better for you. And these get real ephemeral because you need a relationship with your former wife and now co-parent. You need a relationship with these kids. Fighting for an extra dollar of this or an extra piece of this doesn't meet that goal.
They're what is it called? Saving pennies and wasting dollars in that case, right?
Yeah. Well, and the laziest forest for trees. I mean, you're missing the whole fight. But yeah, I struggle with someone. Again, she is a wonderful person who has a wonderful mission, who helps people. This isn't a criticism of her, but I'm mean in CPS litigation when I represent parents. I am vicious towards the department. I'm vicious towards the DAs. I've had a case this week, and again, I'm friends with this DA. We don't agree, and I mean, it is. We are professional, but it is nasty in the mix of it. What their role is, where they should be. Yeah, that's kind of hard. So to the point of like Better Call Saul. Yeah, I don't mind winning a legal loophole rule to win if my client gets there. And to me, I'm making the system better because close the loophole. Figure it out.
It exists there. And in your mind, you're doing the betterment of what aligns with your philosophy. Right?
Yeah. Now, there are times the line's hard, but I think it's obvious in Better Call Saul, there's a point where...
Yeah, like you're breaking, obvious strict laws.
Yeah, if I'm straight up lying,
that's not okay.
Yeah, I think the best two examples I would give in the show, there's one point where he puts a different person in the defendant chair and the defendant's sitting in the gallery and the only witness to the crime, your guy did it. Well, that's not even the guy. I have no problem with that because it's almost an inherent bias by putting the guy in the chair. I do have a problem later on where he gets the cartel guy out because he put a fake family in the gallery to say he's got ties to the community, grab cartel money to post a $7 million bond. That's fraudulent. I think those are easy, but it does start to blend because you're like,
concentric circle.
It's hard, right? And it does take real principle. This is so off topic, I don't care. But it does take real principle because, I mean, what are your real beliefs? And they can get real libertarian. Like, is freedom and your rights, are these really here to be protected?
That's an interesting point you make, and it creates the overlap between being an attorney, getting involved in politics, which very often happens, right? I mean, most mayors, governors, presidents were attorneys, and it makes so much sense now.
Yeah. Well, one, you have an understanding of the process in general, like you just there.
Gives you an advantage. You're involved in the court. People, it's a very public position.
Well, especially prosecutors. They're going to judges or major DAs. You're already political in nature. Actually, my next guest I'm going to introduce later is a candidate for judge here.
Oh, how interesting.
She's awesome. She's really cool. I'm excited. She was a prosecutor for a long time, switched to defense, which I respect. Lost a lot of weight too. I'm excited to talk to her about that. I think she went the Ozempic route, but I still want to talk to her because I'm very proud for people who had a chance to change their lives.
You still have to stick to it.
Oh yeah, and so all that, am I more principled? No, I mean it's like I should be, but to a degree, yeah, I do believe in that. There's such a beauty and richness in our legal system. It doesn't look in practical effect. It's not fair. It's not just. That's fair. But there is a richness to the tradition. Every law, every rule of evidence, it comes from the 1600s, from France and England. There was litigation, there was debate, there was court case after court case. And I get disappointed. Here's a lazy example that we get back to you because you're the actual guest. But, we have laws against what's called evidence, like evidence that suggests someone does something. So how do you say this? If you've stolen in the past, I can't use that as evidence you stole now.
Yeah, because
it's not technically relevant. You got to prove I actually committed the act now. We changed the law for pedophiles. We changed it. You can the law the way to get in evidence of extrinsic acts of pedophilia. You don't need a conviction. You can use hearsay that the guy touched other kids in this manner. Now, why did we do that? Well, I have been floored at the amount of sexual abuse of kids, how rampant it is and terrible, and we want to get these guys, right? And absolutely.
It's political is what you're saying. Well, because here, my thought is it's a very emotionally charged situation.
As it should be. I want to be clear.
100%.
It's a crisis. Let me go further. It's a crisis. It's not just because I don't want to limit it to political, like it's someone trying to score a point. No, there's a crisis of sexual abuse that we don't talk about.
Trafficking, sexual abuse, all the things.
All of it, right? And like familial, uncles, siblings, all that. So how do we stop it? Well, the easy answer is let's make it easier to prosecute them.
You go hard. It's just like DWIs.
That's a very good.
You crack down on it. You make it, hey, we're going to give you this even if we think this is happening.
Yeah.
So you better be you crossing your T's and dotting your I's.
I'm going to have a guy come on about SFTs, and we'll get there in a second. I'll get there because that's a great example.
Yeah. Relevant in Texas, right?
100%. So
click it or ticket. I'll never forget that. It's been used for probably 15 years now.
So here's the rub, right? You probably are putting more offenders away.
Oh, that's seatbelts.
Yeah. You probably are putting more sex offenders away. That's a good thing. That's a really freaking good thing.
Objective.
But we are putting innocent people away.
Not
and
good.
I know we are putting people away. We never could prove it. So now freeze.
Same thing happens in the medical world.
All the time,
You get
right?
a misdiagnosis.
Yeah.
Because we're so afraid of this common diagnosis. For example, what's it? If all you have is a hammer, you're really good at hitting nails.
There you go. Yeah.
Right? So in that, the politicalness of that, not just politicalness, the social, I don't know, this is pop culture, if you will, of whatever diagnosis is now really big, and my patients are coming in thinking they have that. I have to be really good at spotting that, but I have to be really good at understanding differentials for what that could possibly be, which is the same thing to your point. And that could be entirely different from a doctor 20 years ago where this was not a thing.
So let's tie it together. My criticism is, it's not that I want pedophiles on the street. It's that I don't want innocent people put away. So the answer might not be in the courtroom and making it easier to prosecute these people. The answer might be much harder culturally, how we talk about sex, how we report these crimes, giving more credit to kids. Talk about that. That's not an easy conversation. It's not an easy conversation about the 12-year-old brother hurting the 8-year-old sister. Well, what the fuck do we do with that? That's not an easy answer, you know? And we don't want to have these hard conversations. So what do? Let's because no one cares about the falsely accused pedophile. Let's throw him in jail. That's the now again though, I'm not demonizing these people because this is a hard thing to deal with. You've got a kid saying they were hurt, whether they've been manipulated or trained into it or not. No one wants the pedophile on the street. I'm with that, but I have a fear as a guy who, studied with naive, bright eyes how beautiful our Constitution and our rights are, and look at me, big boy defense attorney protecting it. I have a very real relationship with that, and I get scared when we lessen the rules to put people away. DWIs are such a good example. Because field sobriety tests are bullshit. They're bullshit.
I've seen you make a lot of posts about that.
Yeah. Field sobriety tests are similar. We don't, I've done 150, 200 DWI total cases, maybe 7 or 8 trials. In all the cases I've ever done, I've never seen a DWI investigation that subpoenaed the bar cameras or the bar receipts. It's all field sobriety, which are tenuous at best. What I will say is I'm having an officer on who's a lawyer now, a buddy of mine, named Anthony Bancroft, who did DWI investigations. He'll argue the other side, and I want to give him the space to do that.
Well, if I may, as somebody that identifies as and labeled as a neuromusculoskeletal expert, and which includes balance, I would argue that you could have an entirely sober person fail a balance test. You could have an entirely sober person fail repeating the alphabet backwards. I can't do that right now entirely sober.
Oh, no.
Right. So many of those tests, in my thought, is that anybody could fail these. And in fact, many people have functional conditions that make these tests even harder for them.
Yeah. Well, one is nystagmus.
Yes, nystagmus. Their eyes are bouncing back and forth.
Yeah.
People have nystagmus living through this earth. People will also have they'll fail a saccade, which is, do you know what a saccade is?
No.
So if you follow this is a saccade,
Okay.
right? So for example, you should follow this pursuit just fine. If I move my finger really quick and you overshoot, you failed the saccade, right? And so that can tell me that the cranial nerve that controls the movement, the cyclotorsion of your eyes is altered. We say in medicine that eyes are the window into the soul, right? You can tell so much about what's happening physiologically, the general health of the person, somebody's blood pressure, their cholesterol levels. You can tell how their brain is functioning.
I was going to say psychological, I assume.
So many different things, right? If you take methamphetamine, your pupils are going to change,
Coke
right?
the same way, right?
Yeah,
Yeah, you're completely
caffeine.
dilated.
Enough of that.
Right.
You're stressed out. That's another thing I'll do, right? So if I have a patient and I see that their pupils are enlarged chronically, well, I'm thinking, oh man, there's something going on with their autonomic and their nervous system, essentially, right? So sympathetic and autonomic nervous system it's not balanced. Something's going on. But not to get too much into that. The thing is these things are so variable. To your argument about the field sobriety test, is it's probably how could you standardize that across a population that has fluctuations in what their baseline is?
Yeah, the 2 points I make with it are, one, of course it's correlative. I'm not arguing that. Of course, it's very likely someone who's inebriated is going to have more nystagmus, be less balanced. No one's arguing that. But as you just said...
What's the baseline?
Exactly.
You don't have one.
So, but again, it runs to the same issue that I was struggling with the sex offenders. No one wants drunk drivers. No one's making... or only Fringe is making that argument. We don't... The key to stopping drunk driving isn't in the prosecutor and the DA's office. It's... I could stop it today. I could stop it right now. No one wants to do it. 2 drink max at every bar and every drinking establishment.
100%.
Oh, we won't do that, will we?
No.
So you don't really give a fuck about drunk driving, do you? Oh, you give a crap about...
Go a step further and start with education. Start with counseling and families. I mean,
100%.
You could just... I mean, my God. So much of the way people understand and they accept and they think about how celebration is because it was modeled at home. We live in Texas.
Yeah.
There's a massive opioid endemic in Texas. There's a chronic pain problem. As a chiropractor, that's very important to me. There's a massive alcohol issue.
Of course.
Massive.
It's cultural.
It's cultural.
There's a song celebrated, Drinking's a Family Tradition. That's a sad song, man. Like the fuck?
My drinking bone's connected to my
my
party bone or whatever. You know what I mean?
Yeah, dude. Again, it's not judgment. But let's talk about
machismo that comes with it even.
Yeah. It's funny. I do love though, like, when I'm in my 20s, like I can handle my liquor. It's such a flex for me now that I freaking can't. Dude, I love strongman so much.
I start to think about what does Beau's glutathione level look like? How much of this is he depleted in the consumption of alcohol over his lifetime?
Yeah.
Taking Tylenol depletes you of glutathione.
Yeah.
In fact, when you have a Tylenol overdose in the hospital, they'll give you N-acetylcysteine, which is a precursor for glutathione production. So maybe
what's glutathione?
Glutathione has been coined as the master antioxidant. So antioxidants reduce inflammation in the body. Okay, glutathione is also it acts as a pathway system in the liver for detoxification.
Okay.
Particularly for detoxification of hormones. So, since we were talking about hormones earlier, I have seen people that are extremely unhealthy, particularly in their 50s and 60s, and I know they drink a lot of alcohol, I know they eat a lot of terrible foods, and their testosterone's high.
Yeah.
Well, that's a false read of your testosterone, because you're consuming things that are causing such a massive buildup in your liver that you're not recycling that testosterone. You're not excreting it. So you look like you have a good amount of testosterone. Yeah, that happens all the time.
That's crazy.
But you look at them and like, this person has low testosterone.
And is that, I assume that's why, like, if you actually, people who do use hormones enhancing drugs and actually use doctors' help to do it, that's why you take antioxidants and things like that to get a better measure. Oh,
correct. Mundo.
Yeah.
That's part of it.
I do love, so she asked the question here, similarities between legal and medical systems, both are designed to react and not prevent. But it's funny, I would change the bullet point to, when I'm talking about like systemic issues of like drinking and driving or horrible sex crimes of kids, the answer can't just be criminal prosecution. The answer is cultural, and you're telling me the same with medicine. Like, the answer isn't just pain management, take some fentanyl. And again,
I think one of the things I'm most fascinated about, to your point in this podcast, is to see how many parallels there are in the thinking process of a doctor and a lawyer.
Oh, yeah.
It's so interesting to me. The things that we focus on are different, but the way that we extrapolate the problem is extremely similar.
Yeah.
Extremely similar.
Well, and you'll feel the same way if you watch the one with the therapist, too, with mental health. And again, I know that's part of your cohesive approach.
Part of it, but I'm not a subject matter expert like that lady is.
Yeah. So, I mean, it's there's really no substitute for hard thinking, analytics, reading. Like, at the end of the day.
You know what school does? Is it teaches you how to think.
Well, that's what you try to tell people. I don't know if this is true in chiropractic training, but I'll ask the question. In law school, you walk out with your degree, and you take 2 tests, one for professional responsibility and the bar exam. I don't know how to do shit. I don't know how to run a business. I don't know how to practice law. I don't know nothing.
Correct.
But you know what I do know? I do know how to think about problems differently and problem solve with the legal mindset. You know?
Yeah. I have 0 business training.
Yeah.
None. But I know how to be nice to people. I know how to love my patients. You know,
you opened with compassion and empathy for them in the first place.
I do. I carry a coin with me everywhere I go. It was given to me by Dr. Morgan, which was the president of my school. He was the doctor for the U.S. Congress.
Really?
The chiropractor for the U.S. Congress, yes. Amazing. And the coin says, loving service is my first technique. And then on the other side, it says, develop a compulsion to serve that is greater than the need to survive.
I don't have that.
It's beautiful.
But it's beautiful. But I will say, similar in my world, most people, a lot of outcomes in my world are somewhat predetermined.
Sure.
But people who just, if you hold their hand a little bit, proverbial hand a little bit, you're empathetic to the process, you identify. I mean, people are going through divorce or grief. If you give them some of that humanity.
How powerful is it for somebody to know, and people are on all different spectrums, that you believe in them?
It's overwhelming.
That can be everything.
Believe in, people care about.
They've gone their whole life maybe without anybody ever believing that they can be better than.
Yeah.
Wow.
Yeah.
My God. What? Yeah. That's just a universal, like, oh.
Well, I mean, in relationships, like, all around, right? Well, especially, I could go down a long way. I'm going to change tacks because I think we could stay here all day. Give me a little different in, or is it different when you treat, because I know you treat kids, athletes, regular adults. I say regular, but I don't know what else to say.
General pop,
and seniors. Like, how do you approach it different? I mean, I think I know the answer, but I think it's worth asking and getting some response.
Yeah. So I also treat dogs.
That was really fun.
And horses. I mean, yeah. So one thing about me is, like, I like to have a lot of different pots boiling at the same time. Yeah. So as a result, given my degrees and everything else, I like to learn about a lot of different things.
It's fun watching you because you actually love what you do.
I love it.
It's fun, sincerely. Like, I don't, and this isn't just kissing your ass. We're friends, but it's actually fun. You were in my wedding, and we had to make an emergency trip to my house because we forgot something.
Right.
And you're just sitting there as I'm getting whatever. Austin's riding my wife's scooter built for someone a third his size. and
that's such a funny video.
And dude, what are you doing? You take her dog and, like, adjust his hip for whatever the fuck it was. Mm-hmm. And but you have such a passion. All your socials, you treat. We just talked about you're a MMA athlete. Austin's literally the 4th strongest person in the world. CrossFit athletes. I mean, Trey works for you and competes in CrossFit. What, the top 5 female CrossFitter in the world?
She's incredible.
It's just, and not that you don't post those people, but what do I see? The infant, the dog, this. So anyway, I won't shut the fuck up. Talk a little bit about that. Like, how do you approach it different and that kind of thing?
Yeah, no, it's, man, what a privilege to be able to be those people's doctor.
It's really cool. Yeah,
makes me emotional just think about it.
How do you approach? That's cool, man. When we go back to our previous part of the conversation, people go to me for different horrible parts of their life, right? But people are coming to you with pain or something's not working. No one's coming to you because I'm feeling great.
Yeah, it's true. And so when you're in you exist in a world of, you could call it suffering, call it a lot of different things. You want to be the beacon
Yeah.
for people, right? And so to answer your question, everybody's an athlete, not everybody trains.
I love that. You told me that, and I loved it. Yeah.
I believe it 100%. We all exist under gravity. There's weight on us, whether we want to acknowledge it or not.
Mm-hmm.
And we move. So with kids, I never, ever, ever wanted to treat kids. It was just never something that appealed to me. I love kids. They're great. I want to have kids. I have this lovely woman. Her name is Christina. I made her post about her recently. She begged me to see her kids. And shortly after that, another mom brought her daughter in and showed me all of these different adhesions on her hands. And she was going to a pediatrician that was just putting her on antibiotics, destroying her gut microbiome, not realizing that she's predisposing her for depression and chronic pain and for diabetes later in life, which is published information about antibiotic use. I sat there and I was like, wow. I don't have the innate calling to treat babies and pregnant mothers, but if I don't apply my knowledge as an internal medicine trained chiropractor, what's the alternative for these people?
I'll tell you my story with you.
Sorry, one more thing.
Go ahead.
Before
please.
and I want to remind you on that point, is as an adult, your access to care is great. You can go wherever you want.
Right.
As a child,
You're stuck with what your parents do,
you're
right?
stuck with what your parents do. And pediatricians are far and few in between in terms of functional care, integrative care, holistic care, natural care. And the gravitas of treating a child naturally, because they grow up thinking that this is just what you do.
Yeah.
This is the way you approach things. The gravitas of that, there's nothing greater.
Well, now I don't want to follow up my story because it's not like
your experience with me.
Well, I mean, it's a microcosm because it's not as significant of what you said, but I was very overweight. You'll say I am now, but fuck you for that. But no,
I won't say that, but I'll think it.
And so what do? I wanted to lose weight. I found strongman as a method to get in shape and enjoy working out. But, Austin was training me and I found chronic pain problems, sciatic and lower back. And two treatments from you. I went from I couldn't do air squats without stopping my workout to I was at front squats of 500.
What did you deadlift recently?
I had 675 with the suit and it flew up. Yeah, I mean,
what was your PR without the suit?
675, but it's going to be well into the 700s
with sciatic pain.
Yeah.
Again, I'd like to stress, not a knock on medical doctors, but there are so many that my patients go to and they tell me my doctor encouraged that I don't lift weights ever again. Well, don't ever deadlift again. I had a kid, tall, great athlete. Oh my God, he's a receiver. I actually truly believe this kid's gonna play college football.
Yeah.
He had an anterior listhesis.
Good. Talk to me like I'm 5.
There's spondylolisthesis, there's spondylitic spondylolisthesis. There's all these different listhesis.
I don't know what that
means. And what that is it's when a vertebrae has translated anteriorly. Okay. Or it depends what you're referencing. Because this anterior listhesis can also be a retrolisthesis, right, depending what vertebrae.
Which way it was going, yeah.
Right. So the vertebrae, the bone, has broken.
One of the actual bones itself?
Yes.
Okay.
The bone that houses the spinal cord, the very sensitive spinal cord, has now broken and it's shifted forward. This happens in many youth athletes, particularly female gymnasts. He was told he should never, ever exercise again.
The youth athlete was told.
The youth athlete, young man, 14 years old, that he will have to work a desk job and he will live in pain for the rest of his life. I've been seeing this kid for 5 years. He has no pain.
They didn't even offer surgery? I mean, not that I'm running to that, but
no.
Jesus.
Yeah, that's it. So
just don't move it so we don't fuck it up more?
Don't move. And that's the philosophy. Is what's the immediate thing that's going to resolve the pain?
Yeah.
Let's stay there. Don't worry about the sequelae.
Yeah.
of that interaction. Not only is that advice poor, not only is that advice also not evidence-based,
Fair.
not only is that advice also going to extrapolate into a lifelong fear of movement, not only is that going to set them up for metabolic disease, not only is
Not
that
to
going to
mention
set them up for depression.
Yeah, I was at it.
Like look at all of these like
Yeah.
extremely insulting, disgusting results of what that extremely trained, intelligent professional gave this child.
Yeah.
Like I hear that and that and it happens in every profession. It happens in mine. There's a lot of bad things that happen in mine, but you should know better, and you should also have the empathy in your heart to find a solution other than that.
It's look, I am like a tenth of the emotional weight of that story, but you know, if my life on this planet ends, God willing that I make it to like old age, if I reduced 5 years of my life, but I lived it in a way that I got to meet some. Imagine, I don't know what I'm gonna do at OSG. I might be last place, maybe make the finals. Who the fuck knows? But I got to compete next to Graham Hicks and JF Caron. 2 or 3 years from now, I can compete for a podium. If that costs me a couple years at the end, that conversation matters. So the kid you're talking about, if you give him a chance to play college football and tell his kids, God forbid, make money in the NFL and change their whole family's future, if it costs him a decade or he has pain when he's 60, cool, he could have sat back and worked at a desk job. But it's so much more complicated than just stop the pain, right?
And why can't you have both?
Right, yeah, and I'm not saying those are the options, but yeah, I mean, you know what I mean?
But, well, yes, to your argument is health span is different than lifespan.
Yeah.
We should strive for both.
Right.
But also understand that they're both very different. Like for example, my wonderful grandfather, World War II veteran, passed away last month at 97. The last 2 to 3 years of his life he was demented, dementia, Alzheimer's. He was locked in his chair. And my entire life understanding of this individual is he was riddled with arthritis. He never stood up straight. He was in chronic pain. And but he lived to be 97. That's a long life. He did not feel good most of his life.
Yeah.
You know, he drank Dr. Pepper every day. His biggest treat in life was some strawberry ice cream. But he lived on a farm. He grew his own vegetables. He was able to live. But because, let me backtrack. He was put on high blood pressure medication when he was 18 years old.
Wow.
He was on high blood pressure medication for almost 80 years.
This isn't me talking shit. I didn't know they had medication that long ago. For that. Yeah.
Almost 80 years. Dude.
Jesus.
And you think about, does he have high blood pressure? Does he have anxiety?
Right.
Does he have other, you know what I mean? Like, are there other things that are causing? Is he drinking too much? You know, like, oh my God, what could it be? But I don't know, that ramble. But the thing is he lived a long time, but he had to have been miserable for a long time. A lot of it. In the last several years, he wasn't even who he was.
Yeah.
And there's so much information coming out that diabetes is type 3, or Alzheimer's is type 3 diabetes, blood sugar problem.
No shit.
Yeah. You know, in school we even learned, and so for so many years, amyloid plaque was the big thing. Is you're creating this plaquing.
That's what I heard.
Yeah, amyloid plaque, right? That's almost a household name at this point. Is a cause of Alzheimer's, and so we're thinking,
even multiple sclerosis, I think.
MS is a very interesting condition. We can talk about that for a whole podcast.
No one would listen. But.
No, yeah, except maybe some of my colleagues.
Yeah.
But it's coming out that so many of these conditions are caused by lack of general health and wellness. Surprise attack. Yeah. And here's also what I will do to diminish myself, and what I do is that not all things can be prevented by general health and wellness. But guess what? General health and wellness is going to make you a hell of a lot more resilient at fighting whatever disease, if God forbid you get it.
Yeah.
And it should not be excluded from the treatment plan of a disease, especially a very formidable one known as cancer.
I would bet. I don't know. This is just my supposition is it's probably not excluded, but it's never mentioned as the treatment plan.
Like, well, what do they serve in hospitals for food?
Yeah, you're right.
Like,
yeah,
the moment they change that, that'll open my I don't want to say my belief system, but just look at that, dude. Like, you're going to a hospital. This is a place for health.
No. And it's a place for survival, right? I mean, I think that's the part of the argument you're making.
It is. It's a place for survival, and it should be a place for health.
That's fair. Yeah. Or at least say we're gonna tape you up and get you there. Now go see Dr. Reyna and let's live your life a little different.
Go do healthcare. We did critical care. Yeah. Go do healthcare. They're not all encompassing.
I didn't put this together till now, but my mom, who I'd love for you met my mom, didn't you?
I did. I met your mother and your father.
Oh, at Winter and maybe Mayhem. Yeah. Mm-hmm. She went to nursing school later in life when I was in high school, and she did CCU cardiac care, like the long 12-hour shifts for nurses, and then she switched. Now she's like in a vice president role and smarter than me, whatever. I don't know, but. There was a time she switched, and she spent most of her later career in cardiac rehab. So she would take the patients after they got the surgery or the stents, and they would go see this clinic for watch your diet, do these exercises. I'm sure the treatments are somewhat different, but the same. What I'm gathering is the same principle. Principles. They're basic, but critical to someone who
foundational health.
You
can't build a house on a poor foundation.
Exactly, and that's where she found the most joy. We have a running joke with her because all of her patients, what do a lot of people eat? TV dinners and this, and it's laced with sodium as a preservative. And so she lost her mind over her brother who had a heart transplant, and people they just eat all this crap up, and so she doesn't have salt in the house. And we're just so we joke that she's allergic to it.
That's very much that age group,
Yeah. Yeah,
it's really interesting. If you look at different generations, you'll find different dietary habits.
Yeah,
right. The low salt, no salt diet, the low fat diet, which was very big. I grew up in a fat phobic house, and I don't mean as in they had phobia to humans. Yeah. It was the nutritional fats that were very phobic.
So now it's carbs, I assume.
Yes, yes, exactly. We got a lot of carbohydrates.
Yeah.
My dad used to say, "You got to eat those carbs. You got to get big and strong."
Yeah.
And my dad's only brother was a type 2 diabetic, 300 pounds in high school young. So he assumed that's just what men look like, right? They look in high school when I was...
It is what men look like. Yeah, fuck you. Right?
when I was a sophomore in high school, from freshman year to sophomore year, in the summer, I went from 213 to 260 pounds.
Wow. Yep. Oh, I forgot. You...
I was overweight for a long time.
Yeah.
I like to say, an excellent shot putter. There was definitely people better than me.
Not anymore. I've seen you.
Oh no. It's laughable how bad I've gotten at it. Yeah. Actually, the kid that I'm coaching is better at throwing than I am now.
That's funny.
It's crazy. But I was good once upon a time, back in my day.
Almost as good a shot putter as you are, strong man.
Yeah.
I'm just kidding, bro.
That's my thought about strongman is I've trained my muscle fibers for so long in bodybuilding that I still have not adapted back to slow, fast twitch muscles.
It's hilarious.
It's hilarious. I recognize that because the reason I recognize it is because once upon a time when I was a shot putter and I was an offensive lineman, I was a powerhouse, dude.
Yeah.
Like I was stronger then and more explosive then than I am now.
It's
hilarious.
You are objectively stronger in your overhead than me. And I would beat you in every overhead event. It's hilarious.
Yeah. Because I can't apply it the way that I need to. Like if you were to take us and have us isometrically push into a machine,
you destroy me.
I would beat you.
Yeah,
I would beat a lot of people.
Yeah,
but you put me in a strongman comp, it's not there.
I've never seen anybody whose leg drive on an overhead press is down, up, pause, now press.
Yeah. And then I could even get here, and I guarantee you, I have elite lockout.
I believe it. Probably 460 goes like at the top.
But you get me here. Yeah. I got to get here first.
But from here to here, it's just whatever your anterior shoulder can do.
It's a nightmare.
You can't even clean because you're like, I want to do it slow.
Yeah.
Like, dude,
well, you know what?
Dust your hips, bro. It's not that hard.
I was listening to Nick Gardione commentate at OSG, and he's like, "Wow, Justin, he's my chiropractor. He's talking about me. He's like, he's extremely calculated on his deadlift. And he's moving far too slow. If it had it my way, he wouldn't be moving that slow on the way down."
And Austin's like, "I've been fucking telling him this whole time."
It's here, dude. And when I do moving events, like especially yoke, my lord, all I think about is my spine exploding.
Yeah, right.
And that's probably 50% of why I'm so slow at moving.
So
events.
leave it on there longer. Just go.
Yeah, right. But like I'm afraid to unleash it because I'm like, oh my god, it's gonna be uncontrollable. My back's gonna break and blow up all over the wall.
So to mildly even try to stay on track, Ashley's gonna lose her mind. How is it fun? Because I was gonna say, how do you treat?
It's probably the worst out of all of them. It has to be.
Austin's is pretty close.
I'm not surprised by that.
Well, we're buddies. I mean, me and you were buddies. Like these
we're boys. Yeah.
How much fun? Because I mean, I got to know you through training athletes. Like to the extent I'm an athlete.
You are.
Austin.
You're a great athlete. Actually.
Thank you, buddy. Appreciate you. But Austin, it was funny. I'm so old. Like I have such bad habits of just life, and I'm not even upset about it because it's fun to do it now. And when Austin got you the first day, Beau, you got to go see this guy because that's what he thought about. But is it? I love the picture you paint of wellness in general because it's up here as much as it is just in life. And so, what do you end up doing? We made a joke of it, but training dogs to be a little happier, training kids to get a path towards life that's not with a pill or a restriction, but also adults who want to do CrossFit, who want to do strongman, who want to do MMA. Livy may turn out to be a UFC star, or maybe she gets one fight. And this isn't me diminishing her at all. I'm a fan.
I know. But I 100% believe that she's going to make it to the UFC and be excellent.
Yeah, but right now she's. I don't know her finances, but I mean she is a low, like you know what I mean, one of us.
A Fury level fighter, which is still professional, but yeah.
Right. Yeah, and she gets to live a dream even in that capacity. And part of the way is she has someone treating her for that. It is objectively dumb or bad for your health to do what me and Austin do what she does for quote health, except that it's a goal. So you meet someone like you who says, okay, here's how we do it. I do want to shout out, I've got a Dr. Wes who does tailored MD. I haven't asked if he wants to be on. That'd be cool.
I would love to talk to him.
I actually would love to have y'all on together. Because
that would be so cool.
It would be so cool because I think he meets a lot of the goals and bridging some of that gap of modern medicine to there. I'd be curious because maybe he carries some of the arrogance like "fuck you, chiropractors," and that'd be fine and funny too. But
I've found a lot of the modern medical doctor is extremely embracive.
Yeah,
and collaborative with chiropractors. It's the old guard mostly that has a problem.
Because he's our age, or closer to your age than mine, and he does it's tailored MD and it's concierge medical. Mm-hmm. I pay $100 a month, man, and
I've heard he's excellent.
He's excellent. I get unlimited text calls. When I had some mental health stuff, I was able to call, get a Zoom appointment, and get help. I'll just say it: hydroxyzine and alprazolam, which I don't use. I use as needed, but I'm not scared to say it. I had some scares of ADHD. He referred me to a place. My point is, like, he was there. I got strep. I was able to call, give the symptoms.
Beautiful.
I was here. But also, when I talked about my strongman journey, he didn't say, don't lift heavy weights. He said, okay, I did powerlifting. Here's what we can do. We'll do your blood levels here. We'll take care of this thing here. And it was so integrative. Like, here's the life you want to live. And he literally, I think we had the conversation, the first appointment of, quality of life matters, not just the duration.
And well, yes, you always want duration to be maximized. You want your health span to match your lifespan.
Yes.
You like my this girl that I dated, wonderful. She had a dog named Ralphie, and Ralphie, when he was 12, got diagnosed with a heart murmur. And the veterinarian, he's already 12, said if we don't put a pacemaker in him, he's gonna die in 6 months. Like, well, he's 12. I don't know if we want to put him in surgery, cardiac surgery.
Yeah.
So we started cooking all of his food. Ralphie lived to be 16.
Wow.
And not only is that beautiful, what's the most beautiful thing about it, and it wasn't at the time, is that Ralphie died running across the kitchen. He just
passed?
Yep. He had a heart attack and died.
Wow. So, like, painless and just done.
Painless. We never saw it happening. We never expected it, even though he was 16. and he was happy the moment that he died. And it was hard at the time,
Of course.
but reflecting back at it, I'm so thankful that that's how Ralphie died, and I hope that that's the way that I go. And that's the desire that I have for all of humanity, is that you pass away smiling, and you don't realize it's happening.
I think one though. Give me another success story, like just obviously you're not going to name names, but a story that lingers with you.
And I have such a beautiful one. This gentleman came in. He had a traumatic brain injury. He was actually in Austin on a scooter. You know, those scooters you can rent. Fell, landed on his head. He was going about 30 miles an hour when he fell.
Jesus.
Like, downhill.
Yeah. I'm sure not a helmet on the rented scooters,
no,
too.
Of course not, right? Impacted his head. It was so bad that they had to decompress his cranium by removing his skull. Check this out. They sent him home without a skull on the top.
We just had a bandage and a flap.
Yeah, pretty
Jesus.
much. For several weeks. He was walking around outside and was feeling good, feeling like himself. He felt happy again. Went for a little jog. He fell without the top
skull
part.
to protect him.
Rattled his brain. Second TBI within 3 months, let's say.
Jesus.
Came into my office, quadriplegic.
Oh, wow.
Very sad. He was seeing my colleague, Dr. Root, prior to the second TBI. And Dr. Root filled me in. He said, yeah, there was some speech delay, common in TBIs, but fairly normal. He could walk, could live a normal life. Second TBI, quadriplegic. Dysautonomia. His autonomic nervous system was not calibrated. It wasn't working, it wasn't functioning properly. He would fall asleep within 30 seconds of talking to him.
Explain what autonomic nervous system is.
So you have your autonomic nervous system. Thank God we have that. That's everything that happens in your body to maintain equilibrium that we don't have to actively think about. Our blood pressure, breathing, sleeping,
your organs.
Regulation of your organs, all that stuff. The
hormone production, all of it.
Movement of your bowels, all the beautiful stuff. Oh my God. So he would.
I mean, I think about bowel movements, but I get you.
Yeah, all that stuff. He would turn cyanotic. He turned purple. In conversation with him, his whole body's purple.
Oh, because he's not breathing.
He's not breathing. He's not getting oxygen flow. Like his nervous system is not regulating the basic functions compatible with life. He had a feeding tube in, couldn't swallow food. You know, and this is one of the things that got me into chiropractic. And all I was doing was operating the newbie at the time. And very lucky to me, Dr. Root found me, and I cannot believe this, found me valuable enough in my background to integrate into his care with this gentleman. Dr. Root, Aaron Root, Heath, I love Heath as well, but Dr. Aaron Root is probably the single most impactful human in my life. And it's because he saw some kind of value in me at that time to integrate me into this case. And I operated the newbie, direct current electrical stimulation
I hate
device.
to interrupt the flow, but let's explain what the newbie is.
Yeah, it's a direct current electrical stimulation device. Extremely different than a TINS unit, but it creates several different waveforms that are similar, as close as we know that the brain produces into our muscular system and back and forth.
What does it physically do? Like, help it out. I've done it, but I want people to hear.
So it allows us to produce an environment neurologically that's adaptable so that we can find areas, muscles that are receiving decreased axon flow. That's nerve flow. So the muscles are inhibited, in other words. We can identify those muscles, apply the electrodes, and then run patients through normal physiotherapy while they have the neuromuscular reeducation direct current bioelectric stimulation device attached. And so what this allows us to do is decrease neurologic guarding with an injury. And so that was uniquely valuable in this patient. And so throughout the 6 months that we treated this individual, I would apply what I knew, which was very little at the time relative to now, with the newbie. And Dr. Root, as a chiropractic neurologist, which is a specialty within chiropractic, it's functional neurology. He would do different exercises with the eyes, with different patterns. He'd have the patient look up in different ways. He would apply different stimulations through tendon reflexes, different sounds, different things to try to get information into the brain. And I will never forget the day that I was talking to Dr. Root because I thought spinal manipulation was so fascinating at the time. I was like, well, why don't you just adjust him? And he's like, yeah, okay. And he finally started doing that. And it was with this different stimulation that the patient was receiving, along with the spinal manipulation, that one day he got out of his wheelchair and he walked in our office.
Damn, dude.
It was with this stimulation that after the spinal manipulation that he walked through our office. And it was after that I really decided I want to become a chiropractor, because
was he receiving over treatment through other doctors, like
initially yes, and then that family decided to opt out of standard care because it wasn't working.
Mm-hmm.
And he now lives in Austin. As far as I know, I haven't kept up with him in the past couple of years, and he's a financial advisor.
No shit.
He lives by himself.
Wow.
And he makes 9 figures.
Is he single?
yeah. Can you give me his contact? But that is the single most influential piece to my care and who I am today as a doctor.
I'm trying to keep this light, man. You just keep.
I know, it just keeps going. That's why you see all my posts about loving my patients, because it's like when you've experienced that depth of humanity and what we're capable of, it's really hard to not dive in.
Nor should it be.
Why should we experience life guarded?
We shouldn't.
We shouldn't, but we do, because we're afraid to be vulnerable.
Well, yeah. I mean, I know this in like a relational sense and other stuff like that. But I want to go to 3 areas because I could stay all night, but I want to get you home and my wife will kill me. We'll start the process of wrapping up. But jokes aside, I don't know what the fuck fibromyalgia is. Is it real? What is it? And how can you help?
Okay. Fibromyalgia, an interesting condition. It is a chronic pain condition of unknown origin. With my background and my training, which is not 100% fixed, so it is not the only solution. We don't know the only solution. I'm humble enough to accept that. I believe fibromyalgia is a multifactorial chronic pain condition that involves metabolic disease. It involves musculoskeletal, general physical preparedness issues. And it also very heavily involves belief systems on chronic pain.
That's where I wanted to go. I made light of it, and I regret it. So you can leave it in, but I regret it. But that's the stigma. To the point it's fake.
It's not fake.
That's what I mean, but that's the stigma. That's where it comes up, right?
Because it's non-quantifiable. It's not fake. I know people that have had it, but I've had patients that have had it. They have improved their metabolic health, they've improved their mental health, they've improved their physical health, and their fibromyalgia has gone away.
It's my vocabulary is going to be deficient here, but like I've got a relative, one of Katie's family members, very nice person, lady, but lifelong overweight, and never got the education or motivation, and I don't mean like motivate self-discipline. I mean prompting to
the support.
Thank you, support to be like walk more, and it's so sad how this turns into it self-reaffirms. You get overweight, it hurts to walk because this hurts, the knee hurts, the back hurts.
It's a safety pin cycle, right?
Yes, and then I know people have had clients with like fibromyalgia, and they're trained to be like, I need this pill, nothing's working.
You remember the commercial? I don't have a job because I didn't go to college. I didn't go to college because I don't have enough money.
Yeah.
I don't have money because I don't have a job. I don't have a job because I didn't go. It's the
Yes.
same thing, right? And you know, part of me wants to say, a large part of me wants to say, it's not this person's fault. They're a product of the environment.
Yes. It's both, right?
It is, because I also believe that it is our intrinsic duty to do something for ourselves.
Agreed.
But there are also people that have been exposed to environments that don't. That not only do they not enfranchise, they disenfranchise the capacity of a human.
Yes. Yeah. I want to get to the case. I do want to go. I do want to hang out. But before I do, give me I go to see you like unashamedly. Probably not as much as I should, but so when I go in, my typical appointment is you'll one, we know each other and you've treated me for a while, so you kind of know what's going on, and we're somewhat training partners, so you know what the fuck I'm doing. You see my Instagram. You'll say, but it'll be an assessment. You'll watch me move in certain ways. You do dry needling. You'll usually do an adjustment, and then usually it's the newbie for, I'll call it physical therapy. That's a typical appointment for me. What are some of the treatments you do? We talked about labs. We talked about an overhaul there. What's a typical day, especially for what I've seen you for is a chance to be an amateur strongman? What are some treatments that you give that maybe people don't know about?
Different things that we do. So my office offers a multimodal approach. Some of the core treatments that we offer are shockwave therapy, which is compressed sound.
Fuck you for that, by the way.
It's very
that
painful.
Hurt like hell.
It is very painful. It is an off-branching of what we call lithotripsy, which was originally developed to obliterate kidney stones. And after knowing that,
now explains the shit. God damn, dude.
Yes. So they've created a more mobile.
I've got a 5'3" wannabe CrossFitter beating the shit out of me. I don't want to admit that it hurts, and I'm like,
right?
Fuck you,
Trey. You talking about Trey?
Yeah.
5'3". Oh my god, so insulting.
5'2"? I don't know.
Yeah,
whatever.
Yeah, 5'1" maybe.
Okay, yeah.
Nice personality.
Butterface, nice personality.
Yeah. Good hair. Concentrated sound, and this sound originally, again, for kidney stones, has been adapted for sports medicine. So you can imagine a hydrated, healthy tissue. The sound enters and exits like sonar. When sonar contacts a median that's greater than the sound, it reverberates back into the sonar original distribution of that sound device. Same thing happens with shockwave. So we have a damaged tissue. It's lost its plasticity. It's lost its vascularity. It's lost its ability to contract and disperse force. And so we contact that tissue with extremely concentrated sound. And that stimulates a process of healing that we call mechanotransduction, which is mechanical force that is great enough to manipulate the tissue's pliability and elasticity. So the shockwave does that. It also stimulates stem cell production. It stimulates angiogenesis, which is new blood vessel growth, so that tissue can actually allocate blood and protein and amino acids to it to regrow. So we call that a regenerative therapy.
Yeah, that hurt.
We also have the win-back, which is TECR. It's transfer of energy, capacitive, and resistive. This is something you don't get often because we don't like you enough to give you this one. So it feels really good. So this one has deep and superficial heat, which opens up the cell wall.
You've never done this for me.
Never. You've never gotten this once. It also combines multiple waveforms that contract the tissue, and it creates a focal point on the tissue of most resistance, i.e. the damaged tissue, allowing the remodeling of that tissue and the allocation of healing resources.
I bet Livy gets that treatment.
The patients that I care about get that treatment.
Okay. All right.
That's a great treatment for acute and chronic conditions.
Yeah.
We also have the newbie, which is direct current bioelectric neurostimulator. That we use for our physiotherapy, our rehabilitation, and our athletic performance cases. So whenever patients have a mechanical dysfunction and a neurologic dysfunction, we apply the new fit or the newbie method to rehabilitate them.
Make it in simpler terms, because this was cool as hell. You've done this a lot for me. I didn't lift weights through younger and stuff like that, so I've got bad mechanical habits, bad mechanics. So when I want to deadlift, like my glutes want to gauge. So magically you put this newbie on, and now they have to, right? Am I saying this correct?
Yeah. We bias the neurologic system to force your understanding of how to deadlift.
That's crazy. It's really cool though. So now I'm doing like some, maybe like a kettlebell deadlift with a quarter, with a fraction of the weight, but for the first time engaging the right muscles, and it's going there. So it's been really cool. I hate it because Trey just walks in and just freaking turns it all
the dial. Yeah.
Yeah. Well, it's because he's 5 foot nothing and he's got short man syndrome. And,
It's bald like you.
All right.
Oh, there it is. Boom. Whammy.
Yeah.
So the newbie works very much like chiropractic does. The newbie and chiropractic manipulation, it alters the sensory motor cortex in the brain. And so what that means is when you get your spine manipulated appropriately, especially if it's loaded afterwards with exercise, and the newbie, they both alter your perceptions of pressure, your ability to engage your muscular system in coordination. So check this out. The way you perceive 600 pounds, how heavy that feels, is entirely based on your sensory motor system.
Right.
That's the nerves that are sending the information through your spinal cord into your prefrontal cortex and your cerebellum and several different other parts of your brain. That's the only reason you feel that amount of weight. When you get adjusted, when you get your spine manipulated, that's altered. It's more regulated to reality. The newbie does the same thing, is it finds different points outside of the spinal system and it regulates the way that you perceive your senses and how your motor system responds to the information, the sensory system that's being sent in through the spinal cord up into the brain.
In 3 weeks, the last deadlift of my deadlift ladder is 800, and I've got a deadlift suit. Can you just put the thing on so I can pick the thing up?
I could.
Okay.
But what would better suit you is if I found the muscles that have trigger points and I put needles in them.
All right, let's get to that then. Yeah.
Right? And then I manipulate your spine. Then I put you through rehab with the newbie.
Yeah.
That would be, in my understanding, and the reason why my business is this way, the greatest way to have a long-lasting effect on your sensory motor system.
Yeah, and it does work. I'm teasing because I want to win. Somehow magically beat JF Caron, who's been to the.
You can beat him. His knees are weak, like mine.
Yeah, it's gonna be fun. We'll go there. The fact that I'm in the same competition with him is
very
surreal.
cool.
And the one you left out is dry needling.
Dry needling. Oh, my God. So dry needling is an off-branching of acupuncture developed by John F. Kennedy's White House physician. John F. Kennedy had Addison's disease, which is a adrenal gland disease. The adrenal gland sits above the kidneys. JFK was often reported to have a bad back.
No shit.
Yes. And really what it was is he lived in chronic pain because of the Addison's disease. And because he was a president of the United States, they couldn't give him all of these different mind-altering drugs.
Yeah.
So the White House physician found acupuncture to be very interesting, but lacking evidence. So they took acupuncture and they blended it with orthopedic medicine and created dry needling. And so dry needling is extremely effective at manipulating pain by stimulating endogenous opioid production and re-regulating our electrical impulses into muscles. So that's another one of the methods that I combine on top of spinal manipulation and typically new fit rehab to re-regulate how electrical impulses are sent and received through our muscular system into our brain.
Anecdotal for me, that was a game changer. One of the posts I gave was I couldn't air squat. And I'm not elite, but I'm a pretty big squatter for weight.
You're a very strong individual.
And I couldn't air squat without pain down my lower back into sciatica. And within a couple weeks, I was doing the Mars bar reverse with 500 plus for reps to death. I mean, just insane. And
to my point, that's not long enough for your tissues to adapt, but it takes a split second for your neurologic system to change the way it's perceiving information.
Yeah, that's crazy. What's done now is the deadlift suit.
And not to knock a profession, but that's, in my opinion, where standard physical therapy misses the mark. Is they're typically far too focused on the muscular system and don't appreciate how the neurologic system is actually the main driver.
I'm wondering, like, because I know this might be psychological, but also a point of like a coach that's just motivating, like change your perspective. It's not that heavy. Try harder.
Psychologic.
It's crazy, right? Because that's neurological too, I assume.
Smelling salts.
All right, I could stay all day. That was legal heavyweights. I want to get to Rearc the case. This is Tommy Henry versus Dr. Chad Kelly. The short version is guy goes to a doctor, the chiropractor. This guy says you should get an MRI, doesn't do an MRI, does some back adjustments, and turns out he had two herniated discs. Now, it doesn't get into whether that was caused by, exacerbated by, but it wasn't until he saw someone else that he got the MRI to see the herniated discs. And then the question was whether that was appropriate care, met standard of care. And, another day I can go through the details. But what I'm more interested in is what is spinal adjustment? When is it appropriate? What does it actually do? Because again, when people think chiropractor, that's what a very large population think. It's been a wonderful conversation, and I'm excited we're friends. Like I won't hide. Like we'll hang out no matter what. But excited to have you on more to go through more of these treatments, what we can do holistically, and I've learned a lot. But to be really to where people are at, it's Dr. Crack, and that's unfortunate for all the reasons we talked about. But what are they? What are the benefits, and when's it appropriate?
So I'll point out that doctors of osteopathic medicine, called DOs, were the first ones to actually introduce spinal manipulation into the American healthcare system. And DOs are now regarded as very similar to medical doctors. So you can go see a MD or a DO and not really see the difference. So, and they still teach spinal manipulation in their program. Small amount, but they still teach it. Spinal manipulation is appropriate in scenarios where you do not analyze and detect spinal instability.
Okay.
Instability is whenever there is a gross increase in range of motion beyond what it should be. Okay. Whenever there is a herniation of a disc, there is instability in the disc. However, I will also say many people have bulges and herniations of their disc and are entirely asymptomatic.
No shit.
Extremely common.
Is that true for athletes too? Strength athletes?
It's true for everyone. So, I would say that it's very possible to adjust a patient that has a herniation. However, if there is a good evaluation, you will not adjust anywhere near the segments where they're herniated or unstable. So, an example is there are 7 vertebrae in the neck. Someone may have a herniation C4. I may detect that. I may also find it appropriate to adjust C1, the very first vertebrae, 3 vertebrae away from C4, where there seems to be too much movement. I may also find it appropriate to adjust somebody in T1, which is multiple vertebrae away from C4. It is also very possible that that person may experience increased pain that is not relative to them seeing a chiropractor, but it's coincidental because they have a herniation.
Yeah.
It's also very possible that that person experiences life and anything happens that increases their pain. So there's so many different scenarios. And I will also say it's very possible that that chiropractor made that patient's pain worse.
That is what happened.
It is.
Significantly. That's how it actually got exposed.
It's very possible. That can absolutely happen. Anytime you're doing a mechanical treatment, anytime you're moving a tissue, anytime you're touching somebody, anytime you're talking to somebody, anytime you're applying something into the tissue, you have a risk for increased pain.
Yeah.
It is the doctor's due diligence to understand when it's appropriate to apply that spinal manipulative therapy. And if this particular doctor suspected that the patient needs an MRI, he should not have applied a treatment into the neck.
How can you tell if someone has a herniated disc? What are the facts? Like, what do you see? Without an MRI, like without imaging, how do you see?
You can actually detect with a very high likelihood that somebody has a herniation or instability in their neck. One of the common signs, if it's aggressive, would be radiculopathy, which is radiating pain from a central source.
Okay.
Okay, that's like I have pain or numbness, tingling, paresthesia into my hands. Extremely obvious. Okay. Another sign may be loss of range of motion in one or more plane. Okay,
Okay.
this is the sagittal plane, frontal/coronal plane, transverse plane. If they have loss of range of motion in one or more of those planes, they may have disc herniation. There is a really researched cluster called the cluster of Wiener. It's spelled like wiener.
I'm letting that go.
Yeah, cluster of Wiener. The cluster of Wiener is there's a certain degrees of reduced motion and rotation, radiculopathy, and pain on palpation. So you can, if you're doing a good assessment, you're being a good doctor, you can suspect that somebody is not a candidate for spinal manipulative therapy in that region.
What does it do? What do the adjustments do?
Oh my God, we could do a whole podcast on that.
Let's not do that. I know we're ready to go. So
many
let's wrap up.
things. So Heidi Havoc, PhD neurophysiologist, her lab is in New Zealand. She's recently published some landmark studies on spinal manipulation, chiropractic adjustments, and that is that whenever you adjust a segment in the spine, you are altering the sensory motor system. That is the prefrontal cortex and the cerebellum, which is the hindbrain. That is what alters the way that we perceive our senses, as well as our balance. So we know that whenever you adjust the spine, an easy way to think of it is our body is constantly scanning every part of our spine. I know this glass or this bottle is right here without looking at it because my proprioception tells me it's here. Okay, somebody that has an altered system may not remember or know exactly where to reach for that. That's why we see in the elderly population their balance is altered. Whenever you adjust the spine, you're basically turning that light bulb a little bit brighter for the brain to remember exactly where the segments of the body are relative to space and time. So that's one thing that it does.
Okay. Yeah.
Another thing that it does, whenever you do that, you're altering the tension systems in the body. If you have a trigger point, you have a tight muscle, it very likely can be from altered signaling. It actually only can be from altered signaling from the brain. That does not mean that spinal manipulation is the only treatment or the treatment from that, but it means that there's interference somewhere from that muscle into the brain.
Actually, where my follow-up was going to be was, you do spinal manipulation. What should follow? And I feel like I know the answer only because I get treated by you. Is again, I'll get you. Usually, it's in the order of assessment, dry needling, 45 seconds of adjustments. And then the physical, I'm going to call it physical therapy that follows with the newbie or exercises to readjust. So if we skip the rest and only do adjustments, will that make a difference?
It will.
Okay.
But you're leaving so much meat on the bone. Okay. Why would you do that?
I got you. Yeah.
It's hilarious. You go and see the chiropractor, me, and the shortest period of time is the adjustment.
By far.
By a mile.
It's the most miserable.
Yeah.
I hate the fucking one where you put your fist under my back and
a lot of people really like that one. The thoracic spine adjustment.
It's because I'm big
and
I can't breathe.
And inflamed.
Is that what it is?
Yes.
Yeah.
So what I would say is after you adjust, you should load. You should do exercise because you've altered the sensory motor system. You're a computer, right? Your brain's a computer. If you change the way that we perceive load, you take advantage of this neurologic putting, what we call neuroplasticity, this heightened sense of neuroplasticity, altering of the brain's perception. You can change the way we interact with our environment if you just add a little bit of data.
Right then.
Add data.
Yeah.
Add data. And the thing can also, you also have to keep in mind that there is a physiologic or a pathologic expression on an injury. So I would also encourage some type of inflammatory regulation therapy. Perhaps that can be vitamin C, fish oil, vitamin D, a lot of different things to supplement with while you're going through the treatment.
Gotcha. I'll give you the floor a little bit. Anything you want to add before we start to close out?
Man, I think I would just like to add that, number one, I'm very grateful to be on this podcast. This is such an awesome privilege. But to realize that all doctors, chiropractors, medical doctors, there are specialists and there are different providers out there. Just because you have a bad experience with one doesn't mean you should write off the entire profession either direction. I suggest that you search for somebody that aligns with your beliefs and you interview the doctor the same way the doctor interviews you before you select who your provider is. Because I think so many people out there would actually align with functional health and chiropractic principles if they gave it a chance.
Good. Where can we find you, man?
So we're at 14855 Blanco Road.
This is new.
Yeah, that's correct. We just expanded. At the intersection of Blanco and Bitters in San Antonio, Texas, at the Modern Movement Sport and Spine.
You're next door to the melting pot, right?
We are very close to them. They're next door to us.
They're next door to That's awesome, man. Anybody else you want to shout out on the team? You got social medias and stuff?
Yeah, I would like to shout out my staff at the clinic real quick. Trey Volpe. He is...
The short CrossFitter, the bald one. Yeah.
He is. He's a workhorse. Puts a lot of effort into his patients and truly wants people to succeed. Olivia, my practice manager, is one of the most impressive employees I've ever come across. Lisa is she has a huge heart and cares about people as well. Those people they've filled in a lot of my insufficiencies as a person, and I appreciate that greatly about them.
Mm-hmm. Well, look, thank you to Dr. Reyna for joining the show. If you want to learn about Justin's work or explore how functional health and chiropractic care can benefit you, check out his website and follow him on social media. I'm going to put all those links in the description, but I know specifically his Instagram page and the Modern Movement Exercise page. That's it for episode 5 of the Fiegel Files. Thanks for tuning in. Stay tuned, because next week we're sitting down with Marissa Giovinco, who's a former prosecutor defense attorney who's running for the judge in the 226th Judicial District Court. I should have this memorized, but I don't, so we're going to read it off the script. Until then, subscribe so you don't miss an episode. If you need legal help, visit my website at divorcelawyersa.com. Follow me on all my social media platforms. Stay strong and go LSU Tigers under now the new interim head coach. So.